So thank you, everyone who's online. And we know that there are going to be more people joining us. So thank you for this is our first grand rounds of the semester. We are the Office of Practice and Research within the Jiann-Ping College of Public Health. And we are very honored today to have Mr. Vence Bonham, who is an associate investigator in the Social Behavioral Sciences Research Branch at the National Human Genome Research Institute at the NIH. And Mr. Bottoms leads the Health Disparities Genomics Unit in the Social Behavioral Branch. And as you all know, he focuses his research on the research and evaluation approaches to integrating new genomic knowledge and precision medicine into clinical settings, and with a real deliberate effort to not exacerbate inequalities. And so he's looking at that and integrate that into his work. And I'll let him say a little bit more about the precision of what else he does. But just on a personal note, I've known Mr. Bottoms for quite a long time. He's both a colleague and a really, really great friend. So we appreciate you coming and talking to us today. And welcome to Georgia Southern. And I'll turn it over to you.
All right, well, great. So great, Joseph. Thank you for the invitation to come and to speak today and have the opportunity to have the conversation today. So let's see if I can share my slides. All right, so can you see my slides?
Yes.
All right, great. Well, I am so pleased to be here today to have the opportunity to talk to you about things that are happening at the National Institutes of Health, at the National Human Genome Research Institute, and really to explore this question, is genomics relevant to public health? And I really would like to use this as an opportunity to examine this question about where the field of public health is and its relationship to the field of genetics and genomics. So let me walk through what I'm going to talk about today. First, I just want to take a minute, and particularly for the students that may watch this talk today, I want to just talk a little bit about the National Institutes of Health and the institutes and centers that make up the National Institutes of Health. I want to talk about the vision for the future of genomics that was established by the National Human Genome Research Institute, and to really explore several of the areas within this vision that I think are directly relevant to the work of public health. And then I really want to frame my question around the title of my talk. Is genomics important to public health? And talk a little bit about public health genomics. Focus in on COVID-19. And then I want to talk for a minute about my own research to give some exposure, particularly to the students, but also to the faculty of the research that I'm doing in the intramural research program at the National Human Genome Research Institute. And then I want to end my talk just talking about some issues around the importance of diversity in the field of genomics. So as we enter the month of March, it's, I think, an opportunity within our country and within National Institutes of Health, where biomedical research is really in the forefront with regards to seeking to improve the health of our country and globally. And the examples of where biomedical research is having such importance with regards to addressing the pandemic that we currently have, as well as thinking about the broad context of public health and how can we improve the health of populations across the United States and globally. And so here in this slide with President Biden and Dr. Corbett. Dr. Corbett is an investigator at the National Institutes of Health, and she has been one of the leaders in the development of one of the vaccines for COVID-19. And I just want to highlight Dr. Corbett as someone who is playing such an important role, and as a Black woman and a investigator at the National Institutes of Health. So particularly for the students, I just want to give you a sense that the National Institutes of Health is made up of 27 institutes and centers, but the jewel of the National Institutes of Health is the clinical center. And this is the image of the clinical center. This is the largest research hospital in the world. Every patient that is at this facility, either as an inpatient or an outpatient, is on a research protocol. And many studies are going on, including work around COVID-19. that is helping to improve health. But one of the important things that's really happening is a much more of a framing around the importance of the relationship of the work that's going on at the National Institutes of Health and public health, and how do we work together to actually improve the health of populations. The National Institutes of Health is located in Bethesda, Maryland. This is Building 1, which is the oldest building on campus. And I just showed a map to give particularly the students a sense that this is like many college campuses, but it is a campus that is a part of the biomedical research engine of our country. So I would refer you to the National Institutes of Health website to learn a lot more about the various institutes and centers. There are 27 institutes and centers that make up the National Institutes of Health, and I'm at the National Human Genome Research Institute, which is one of those 27 institutes and centers. So let me take some time now and talk about the National Human Genome Research Institute's strategic vision for 2020. And I would encourage you to go to this article that was published in Nature last October. The reference to the article is at the bottom of the page. And it's an open access article, so you can go and download it and have an opportunity to really read and think about the field of genomics and its importance for public health. And the vision is structured in 4 different areas. There are guiding principles and values that have been identified as important principles and values for the field of genomics and genomics research. There are robust foundations for genomics, what our institute will do to help move forward the field of genomics and what we see as some of the foundational areas that we have an importance to conduct research. And then the third area is breaking down barriers. We identify some of the barriers and obstacles and challenges in moving forward the field of genomics and what our institute can do to help to address those barriers and break down those barriers. And then the final area is we identify a set of compelling genomics research projects that we believe are important to move forward, to move forward the field and to move forward the science from the perspective of improving health and reducing the burden of disease. And we see this as at the areas of the forefront of genomics. And we identified it as the forefront of genomics because genomics is now integrated in all parts of biomedical research. And so our institute really is seeking to take those areas that we can focus on with our resources to help to move the field forward for everyone, but with a recognition that our institute cannot do all of the work or fund all of the work with regards to genomics today in 2021. So let me start with a guiding principle that I think is important to biomedical research, but to public health. And that guiding principle is to maximize the usability of genomics for all members of the public, including the ability to access genomics in healthcare, engagement, inclusion, and understanding the need of diverse and medically underserved groups are required to ensure that all members of society benefit equitably from genomic advances, with particular attention given to the equitable use of genomics in healthcare that avoids exacerbating and strives toward reducing health disparities. This is an important fundamental principle for the field of genomics. As the work moves forward, we need to recognize how do we make sure that everyone benefits from the work. And this includes issues with regards to who participates in genetic and genomic studies and the importance that we have individuals from diverse ancestral populations across our globe to participate in genomics research so that everyone can benefit. By only having certain populations within the studies, it limits the potential of our genetics and genomics research. Today, over 80% of all research studies in genetics and genomics are in European populations. And when we think about Europe, it's really only about 13% of the world population. So the vast majority of the world population is missing from genetics and genomics research. And we're learning more of examples by understanding variation and knowledge across the globe and across ancestral populations. We learn new information that actually helps us in developing new treatments and our ability to actually make sure that everyone benefits. But there's another level with regards to making sure that everyone benefits, and that's with regards to the implementation in healthcare. How do we make sure and maximize our ability that individuals can get the benefits of genetics and genomics and precision health within their treatment? And how do we grapple with the inequities and disparities that we have in this country with regards to healthcare? So one of the sustaining and improving robust foundation areas that we identify is, what happened? Okay, let's see what I do wrong here. So one of the areas of foundation areas that we identify is understanding the role of genomics in human health requires knowledge and insight about how social, environmental, and genomic risk factors interact to produce health outcomes. So this issue of when we think about genetics and genomics and its importance in health is understanding it is integrated with regards to our understanding of social and environmental risk related to health, that we can't just look at biological and genetic and genomic issues that are important in risk in disease and in health, but we must also put it into the context of the social and environmental context and how they interact in importance in health. So this is an important principle that we've identified for the field of genetics and genomics. So let me get to my question. Is genomics important for public health? And really to explore this and really to try to describe and talk about some of the important issues. And we talk about this in the vision document that I'm referring you to. And one of the areas that we talk about is universal newborn genetic screening may represent the most visible and successful approach to population-based identification of serious and treatable inherited conditions. Newborn screening, which has been a part of public health for a number of decades, is fundamental to the field of genetics and genomics, and our ability through newborn screening to identify individuals who are at risk, but where action can be taken to help to improve their health. One area that I will talk a little bit more about is sickle cell disease, but there are a number of conditions where through newborn screening, we can identify at newborn the ability to intervene to improve the health of an individual child. This is an important, I argue, area of public health genomics and an important jewel within the field of genetics and genomics is newborn genetic screening. I refer you to our sister agency, CDC, and their Genomics and Precision Health program. Dr. Muin Corey is the director of that program, and the resources that they have about public health and genomics. And this is their website, which I refer you to learn much more about what is all of the programs that they're taking on within their office at the CDC. And this article, which was published a couple years ago by Muin Corey and his colleagues from Public Health Genomics to Precision Public Health, a 20-year journey, he really explores and examines the role that that genomics has played in public health and where the potential future is for this area. And again, I would refer you to this review article as a help in the frame of thinking about the role of public health and genomics. So let me just walk through a couple slides where our examples today, I believe that this connection between public health and genomics is so essential. And one is related to hereditary cancers. So it's estimated that between 1 and 2 million people in the United States have these conditions. So as we think about hereditary breast and ovarian cancer, we think about BRCA1 and BRCA2 gene variants, but other gene variants that put individuals at higher risk for cancers, and that having that knowledge can be important at a population level and thinking about the role of public health. Lynch syndrome is another area with regards to colorectal cancer, where again, this is a genetic basis in our ability today to do screening to identify individuals at risk and then take interventions to help to reduce chances of cancer by additional screening and additional public health efforts with regards to individuals to help to protect their health. So I argue one of the areas that public health and genomics is connected is around hereditary cancers. A second area is coronary heart disease, and particularly with familial hypercholesterolemia, or FH, is a genetic disorder that affects about 1 in 250 people and increases the likelihood of having coronary heart disease at a younger age. And current estimates suggest that fewer than 10% of individuals with FH in the United States are identified. And this is an opportunity with public health surveillance, our ability to identify individuals that are at high risk for FH is something that I believe today we can implement from a public health perspective. And it's clearly one of the areas that the CDC has focused on. And a third area we've talked about, and that's newborn screening. And again, newborn screening, I think, is essential to the relationship between public health and genetics and genomics, and how it's having an impact with regards to improving the lives of individuals. I refer you to the CDC website, and they have a newborn screening portal that has information that can help in facilitating and understanding how to implement newborn screening, the relationships that are going on between the CDC and states across the country, as we now in our country, all 50 states are required newborn screening with different screening in each state. But again, this ability to use information that's actionable to improve the health of a child. So the last area that I want to focus on with regards to public health and genomics is pathogen genomics. And pathogen genomics is an investigation of outbreaks of foodborne illness, better targeted tuberculosis control, and more timely and granular influenza surveillance to inform the selection of vaccine strains. But our country and our world over this last year has clearly recognized the importance and the relationship between public health and biomedical research, and particularly genetic and genomic research, with this pandemic that we're all living in. And so this slide is from today. This is the CDC data tracker, latest number on deaths in our country, the number of cases and individuals that have died from COVID-19, and the impact that it's having in helping us see the inequities that exist in our country and the loss in this country, but also the loss globally and the impact globally that this pandemic is having on our world. And so I would say this is the example that we have today to say, yes, that public health and genomics are connected because this pandemic is showing us in many ways. I refer you to this article that was written by Muin Corey and his colleagues that was published in JAMA, Precision Public Health as a Key Tool in the COVID-19 Response. Again, this issue of how do we connect what happens within our public health infrastructure across our country using genetic and genomic data to help us in surveillance and our ability to develop vaccines and understand differences. We talk about this in our vision statement, and so I refer you back to the genomics vision for the next 10 years, where we talk about COVID-19 and the impact that genomics has had with regards to helping us understand the virus, helping us develop new vaccines for the virus, and helping us with surveillance of the virus. So this is an important area for the field of public health. And when we think about COVID-19, we are seeing differences, genetic differences with regards to morbidity and mortality, and trying to understand the causes for these differences, which are things that we must study. But we also must recognize the inequities that are all based on social determinants that we are also seeing in our country with regards to loss of life and some of the ways that this pandemic is impacting certain communities, certain cultural and social groups, certain social economic groups in different ways, and understanding those so that we can now intervene to address those issues. This slide is a slide I created last summer, all about images about the state of Maryland, where I live, and the challenges and the disparities and inequities that we see with this pandemic, and a recognition the inequities, the structural racism, the things that cause these inequities that we are seeing in our country, and how do we go about intervening to address these inequities. But these inequities are not just to who is getting the virus and what happens to individuals if they receive COVID-19, have COVID-19. We are also seeing inequities with regards to the issue of who's getting access to the vaccines. This is a real-time example of inequities in our country. And as we grapple to get vaccines, to get back to normal, and we are seeing inequities in who gets access and what are the challenges and barriers with regards to access. And then, of course, there are issues with regards to hesitancy. But I argue right now that the important issue is access, not hesitancy, that we must address in our country. So, is genomics relevant to public health? My answer is yes, that it plays an extremely important role with regards to the connection of genomics and public health. So I've known Dr. Telfer for over 20 years, and I've been involved in the field of public health for over 20 years, and thinking about the relationship of the conversations around genetics and genomics and public health, and how they've been challenging at times over the years, and perceptions that resources were going to fields like genetics and genomics or into biomedical research and not into public health. And I think this pandemic is showing us some of the challenges and problems with regards to those issues. But we're also seeing today how these two fields really are connected, and that we must work together in a way to improve public health by using genetic and genomic tools as a part of a larger component of tools of addressing issues with regards to the environment, addressing issues with regards to social determinants, addressing the variety of issues that impact population health in the United States and globally. So we must think about how do we work together as different fields of science to improve health of populations. So I want to take a minute, and this is particularly for the students, just to tell you a little bit about the research that I do in the intramural research program at the National Human Genome Research Institute. And much of my work is focused on sickle cell disease and sickle cell trait. And I argue that there's this connection between public health and sickle cell disease and sickle cell trait that is really important for our conversations with regards to both learning about inequities, learning how we use public health systems to improve health, and to learn about some of the challenges and barriers that this disease community and carrier status community have. So let me just walk through very quickly. As you know, sickle cell disease is a single gene disorder. It has been identified as the first molecular disease by Linus Pauling in 1949. It was first identified by James Herrick in 1910 in the United States and within Western medicine. But until recently, there's only been one treatment, hydroxyurea, and within the last 5 years, there's 3 additional FDA-approved drugs. But for the vast history of this disease and our knowledge of this disease in the United States, it's had limited resources to support addressing individuals living with this disease. There's multiple types of complications. One that's most commonly known is pain episodes, but there's multiple complications with this disease that cause a significant burden and early mortality with individuals living with this disease. My own research group is doing a study of adults living with sickle cell disease. This work is going on at the Clinical Center at NIH, as well as with a colleague collaborator at Montefiore Medical Center in the Bronx, New York, Dr. Caterina Minetti. And this is our conceptual model for our study and our research, where we're looking at the clinical phenotype and examining these issues, but we're looking and focusing in on psychosocial issues, the study of stress. We're studying stress both from a social context as well as a biological context, exploring issues with regards to the microbiome and understanding the role of the microbiome with regards to variation in the disease. We're doing whole genome sequencing on our study participants. And then we are trying to understand the role of the healthcare system in the variation that we see with this disease. So this is our model that we use. I'm happy to talk about it more in our question and answer period. And so sickle cell disease and sickle cell anemia, this is from Dr. Tisdale and colleagues' paper that came out in Science in 2020. It's just a nice graphic of kind of really talking about the different approaches with regards to current treatments and future treatments. So my research group is studying some of the issues around these future treatments, particularly around gene therapy, both gene addition and gene editing. And these are all articles from our lab, research that we've been doing over the last 5 years around CRISPR gene editing and gene addition, gene therapy for sickle cell disease, and exploring the issues of what are the views and attitudes of the community, individuals living with disease, parents, and their providers around these new gene therapy and curative therapy approaches, and willingness to participate in these clinical trials. But the context of sickle cell disease is not just focused on the United States. We must think about where the real burden of this disease is, which is in sub-Saharan Africa and India, where the vast majorities of the individuals across this globe that have sickle cell disease or one of the genotypes, the sickle cell genotypes. And I think it's important to recognize that from a public health context, as well as thinking about curative therapies, that we must understand the burden and the impact it's having on mortality, where in sub-Saharan Africa, 50% of children don't live to the age of 5 years old. The limitations in treatment and care, and how can we think about this from a global context? I argue that's a public health issue also. So the second area that my group is doing work around is sickle cell trait. Again, I refer you to the CDC website. They have a great website of resources with regards to sickle cell trait. Sickle cell trait is the carrier status. For years was recognized to be benign, but we're learning more that in certain rare circumstances, individuals may be at higher risk for certain conditions. One of those areas is chronic kidney disease. And I, along with a group of collaborators of hematologists and ethicists from across the country, did a systematic review of all clinical outcomes associated with sickle cell trait. I refer you to this article, where we do identify several areas that there is strong evidence that being a carrier or having sickle cell trait puts you at higher risk, but that there's a need for a lot more information, a lot more study with regards to sickle cell trait. And I know that on the Zoom call today is a faculty member there in your school who's been doing work around sickle cell trait and sickle cell trait with athletes, Dr. Lawrence, and I just want to acknowledge her and her important work. But this issue about sickle cell trait, I argue, is a public health issue. When you think about the number of individuals living as a carrier or having sickle cell trait in the United States, that these are issues that we need to explore from a public health perspective. So now let me return to our vision and explore this issue from a different component, and that is with regards to our workforce. And that the field of genomics has acknowledged that our workforce is not diverse, and that we need to be very intentional to champion a diverse genomic workforce, that the promise of genomics cannot be fully achieved without attracting, developing, and retaining a diverse workforce, which includes individuals from groups that are currently underrepresented in the genomics enterprise. So our institute is taking this on as an important area of focus, is that we must take steps to increase the diversity of the field of genetics and genomics, bring additional people within the tent to be part of conducting innovative research to improve health, and we need people to do this work. So we have a new action agenda at the National Human Genome Research Institute. I refer you to that action agenda. You can see the website where the action agenda and a commentary that the director of our institute, Dr. Eric Green, and I published in the American Journal of Human Genetics. The genomics workforce must become more diverse, a strategic imperative. I encourage you to read it and explore this issue with regards to our interests. So I'm going to be very selfish for just 1 second. And this is again for the students out there that are about to graduate. My research group is looking for a new research analyst or study coordinator to join us. These are some of the requirements for the position. If there's someone who's interested in this position and to come to the Washington, D.C. area, email me and I can have further conversation, and you can send me your resume or CV. But I'm interested in looking across the country for a new staff member within my own research group. So now let me close on some exciting things that are happening at the National Institutes of Health. Last week, the National Institutes of Health identified a new initiative that was focused on issues with regards to structural racism and biomedical research. I refer you to this webpage, and I refer you to this request for information. I encourage you to go there, read the questions, and respond, and provide NIH your opinion about what are some of the issues to advance and strengthen racial equity, diversity, and inclusion in the biomedical research workforce, and advance health disparities and health equity research. I'm honored to be a member of the Unite committees focused on issues of health disparities and health equity research. And NIH is taking a number of steps to expand the work that we're doing around structural racism and expanding the work that we're doing related to health disparities and health equity. So with that, I just want to say thank you. I look forward to the questions. And again, I'm happy to be here today, and I look forward to having interactions with some of you. Thank you.
So thank you, Mr. Bonham. I think we all want to get a hand of applause there for you. Thank you for that. So we now are at the point where we can entertain questions. So you can unmute yourself, introduce yourself, and Mr. Bonhams can answer your question. And I have a comment in closing, so please, we'll follow up. Feel free. Anyone?
Hi, Dr. Bonham. My name is Ariella Ward. How are you? That was a great presentation. I want to commend you for that. I'm kind of old school. I started out in sickle cell research and kind of digressed after that because there really wasn't a lot of opportunities. So I just want to thank you for that. And where else do you see genomics going besides sickle cell disease?
So, genomics is taking over a lot of areas, particularly related to precision health and identifying the best treatments for individuals and using genetic information as well as environmental information in making that context. So as precision health becomes a broader part of healthcare, genetics is going to be a part of that. And we're moving away from these population descriptors, the use of our racial and ethnic descriptors about who should get a certain drug, or who's at higher risk, to really start to look much more at a genetic basis and how that information is important in looking at risk. The issue of polygenetic risk scores to understand risk for various types of diseases. But again, I think the areas of cancer is clearly leading this with regards to both treatment of individual cancers, but also understanding who may be at higher risk for certain types of cancer, understanding better cancer in a different way than we historically did. Also, the issues of heart disease, I think, is the other area that's going to lead really the use of genomics. So those are two examples. Cancer, clearly, we have numbers of examples today with regards to cancer, but heart disease is a second area that is right behind.
Thank you.
Thank you.
Other questions, comments?
This is Carl Peace. I have a question about the extent to which Dr. Bonham's center might interact with the bioinformatics branch of the NCI.
So the National Human Genome Research Institute is involved in genomic data science across NIH. We have a lot of collaborations with NCBI at the National Library of Medicine, but we also collaborate with NCI and other areas within NIH. As you know, genomics is now a big data area where there is so much data that we need to use different analytical tools and ways to understand and interpret information. Our institute has a new initiative called Anvil, which is our cloud system for doing research. We're in collaboration with All of Us initiative with regards to their new genomics efforts and helping and facilitate some of the work that they're doing within the All of Us program. So we integrate across NIH around genomic data science. We collaborate with other institutes and funding of different initiatives in this area. We have a long-term relationship with NHLBI and TopMed and their initiative with regards to genomic science. And how can we create better tools that can be used by various types of researchers to do their work, to better understand variation and understanding the genome and its impact related to various types of diseases.
That's great. Thank you very much.
So I do have a question. Thank you, Dr. Peace. I do have a question. So you mentioned the All of Us, and so we sit on the NIMH advisory committee, and I can attest that genetics and genomics are a big piece of their part of their research. Definitely their research. They have a whole section, more than one section devoted to that. But the All of Us project is a pretty critical one. Could you say a little bit more about that to educate us on that issue, on that?
Right. So the All of Us program is a program that started out being named the Precision Medicine Initiative under President Obama's administration, and has continued to get support, congressional support over the last, 12, 14 years now. And its initiative, which is now called the All of Us program, to recruit at least 1 million Americans to participate in a longitudinal study with regards to environment, social issues of health, and genetic and genomic, to better understand risk and benefits with related to disease and understanding of health. And it's one of the important things about the All of Us program is that it's seeking to be very diverse. And so it's very intentional in recruiting individuals from underrepresented groups within biomedical research. And so developing new strategies and approaches and studying these questions with regards to engagement of diverse communities across our country. And so it is an important program within the NIH that is really moving forward to develop a resource for everyone to use to better study and to understand differences in health, the role of behavior, the role of social context in health. And now some of that research is available for researchers. There is a researcher's website that you can go to where data on the first 200,000 individuals is available to study. And so I would encourage you, if you have an interest in questions on all types of different questions, because they now have over 200,000 individuals participating. And as they seek to reach their 1 million, we can start to look at different patterns and different issues to try to understand relationship to various components of risk for disease and what protects people, resilience, studying resilience and health. So the All of Us program, if you're not aware of it, I would encourage you to go to their websites. And it's going to be an important jewel, I think, within NIH over the next 20 years and as an important resource to our country.
Thank you for explaining. Okay. Other questions or comments?
Hi, Dr. Bonham. My name is Erica Murray, and I'm one of the Masters of Public Health students. And last semester, we briefly examined the genomics, and I just want to thank you for expanding my knowledge today of genomics and how it relates to public health. That really helped me to make the connection between the two.
Great. Well, thank you for that comment. And I would encourage you to, read our strategic vision. And I think it'll give you a broader perspective also, as well as there's a lot of literature out there. And I just want to acknowledge my colleague, Dr. Muin Corey at CDC, and the important work that his office and that he's been doing over his career around genomics and public health. And so you can dig into it to learn a lot more. And there's a lot of exciting things out there. So I encourage that of yourself and your fellow students.
Thank you.
Hello, Dr. Bonham. How are you?
I'm good. How are you?
Good to see you again. I just wanted to thank you for bringing this to our students' attention, because I think Dr. Telfair knows that we've talked many, many years about how we fit into public health and the genomics and how it all fits together. And I think it's really coming to light now. And I haven't done a lot of work with sickle cell trait. Lately, I've moved really into community engagement, and I'm on the Cure Sickle Cell initiative, where we're looking at this gene editing and all of these things. And I'm very interested in knowing what you found as far as the community and how receptive they are to the gene editing in sickle cell disease.
Yeah, no, thank you for that question. So I conducted a study that explored adults living with sickle cell disease, parents with a child with sickle cell disease, and providers, healthcare providers, who cared for at least 10 patients with sickle cell disease, to explore the question. And this was just before the first clinical trials were approved by the FDA. It was clear that this was on the horizon, that there would be new gene therapy trials. And we wanted to get a perspective of what the community thought about this. And I guess there's three themes that I would identify that came from that work. One is that there was an excitement and a perception of hope, that there was now much more attention being provided to this disease that had been known for over 100 years, but there had been limited research and resources going into it. And so this new attention on the disease was seen as hopeful. The second area that I would identify that was a major theme was wanting to have all the information about the risk related to these new therapies. And this was an issue that was articulated, and we have 3 papers that came out of this work that you can look at. But one of the clear messages was that people wanted information. They understood that there may be risks related to these gene therapies, but they wanted all information that they could have to help them make an informed decision about whether they wanted to participate in one of these clinical trials or not. And then the third area that I would highlight as a major theme was a concern not about the clinical trials, but about the cost once this gets implemented. That the cost to actually have these treatments would be out of the reach of the sickle cell disease community. And so the sickle cell disease community will help to perfect these new techniques, but then not benefit from it. That was a message that we heard across our sites for our study, that the concern that the cost of this would put this out of reach of individuals living with sickle cell disease. As you may know, there's been a lot of exciting work going on, and then just recently, several of the trials have suspended because of the deaths of a couple individuals. And so we're at this really tipping point with regards to both the excitement and the potential and the examples where we have seen where these new techniques around gene editing and gene addition are really becoming a curative treatment for individuals, but also recognition that there are some risk. Mm-hmm. And so this is an important area of work. My research group will continue to do work in this area around education and informed consent related to participation in these clinical trials.
Thank you.
Mm-hmm.
If I can interject a question. So a couple of us know this answer to this question. However, I think it's really good for someone like yourself at your level and then what you do to share this though. So talk a little bit, if you will, about what got you interested in a public health perspective, as well as a focus on inequities, the possibility of being able to address inequities in your area, which is considered extremely complex at many levels. So those two questions, if you will.
Yeah, so, the first question about kind of what got me interested in thinking about these from a public health context, I'm going to say two things. One is, I come from a community. I was born and raised in Michigan. My parents are from Alabama. They left Alabama because they could not go to school in Alabama. They had to leave the state, and the state paid for them to leave the state to go to Michigan to go to graduate school. So I come from a context and a history of segregation and racism, and seeing within my community where I lived and grew up, the disparities in health outcomes. And so I became very interested early in my career in how I could, as a career, have an impact on the health inequities that I was seeing within my community and across our country. So that's what I got connected to issues around health disparities. And early on in my academic career, I went to an American Public Health Association meeting. And when I went to that meeting, I realized I had gotten to the right place because you had a diversity of individuals from different disciplinary backgrounds, all focused on improving public health, improving the health of people and of populations, with clearly an overlay of issues around equity and thinking about those issues of equity. And so the connection there for me with public health was there. And as someone within the field of genetics and genomics from the very beginning, it's always been a question is, how do you think about the field of genetics and genomics and its importance for equity and access and understanding those issues? And now in 2021, these issues are in front of us every day. I arrived at the National Human Genome Research Institute right at the completion of the Human Genome Project, and it wasn't clear exactly what was going to happen. But what has happened really over these last 15 years clearly is the implementation of genetics and genomics and the question about who will benefit and who will not, and why we need to study that question and challenge that. And that's why I study sickle cell disease, because I see sickle cell disease as an example of a genetic disease that is also a disparity disease, and this issue of equity and thinking about those issues. So I think that there's this connection in thinking about issues of social justice, equity, public health, population health, and genetics, that they all come together. And that is important both from a perspective of treatment, but also what diseases we study and how we study those diseases and who gets studied, that is important for us to be exploring with regards to this issue. So I hope that answers your question, but it really is coming together of thinking about both issues of equity and justice and population health with how do you use knowledge around genetics and genomics.
Thank you. And I could, we always appreciate from our college in particular, because of our focus and our mission, the perspective that you just shared and you bring to all your work that you do. And the time that we've known each other. I think we actually met through public health, first of all, then through actual other things. So that's a thing. Any other comments or questions?
I have another one, Ariella Ward.
Please.
I'm just so fascinated with this. Have you ever considered nutrigenomics in health disparities, especially because of the high cardiovascular disease among African Americans and minorities? I just think that that's a field that may, I'm not sure where it is at this point, but I know it was something that was really interesting for me as I was going through this.
Yeah. So within my own research group, I have a fellow that is working with a staff scientist who's a physician at the clinical center on a study with regards to diet and sickle cell disease. And so we're exploring some of those questions there. But broader, NIH is doing work around nutrigenomics and starting to try to understand that. And actually the All of Us initiative is doing some of that work in collaboration with other parts of NIH. So a recognition that there's much more we need to learn about these issues, and that now we're getting to a place with regards to having large cohorts where we have the ability to just kind of study those questions, so that over the next 10 to 15 years that maybe we can learn much more information that can help us understand the relationships of genotype and nutrition and understanding to help individuals with regards to their health. But related to the work that I do in sickle cell disease, we've become really interested in issues of diet as part of understanding variation in the disease.
Absolutely. Thank you so much.
Okay, well, thank you so much, Mr. Bonham. That is, we'll have to have that as our last question. So a couple things. First of all, thank you so much. And we truly, truly appreciate you taking the time out of your day, your week. We know the phenomenal amount of effort that you commit to and you work at. So thank you so much for gracing us with your time. To everyone else, thank you all for attending the call, particularly the students. Keep in mind that we here in the college have an ongoing seminar series, and we want to alert you that we have one of our actual alumni who will be speaking on Thursday. Ms. Harvey will send out the notice to you, and just pay attention to our seminar as well as our companion seminar series that is overseen by Dr. Fung. So anyway, we want to thank you all for your time and your effort, Mr. Bottoms in particular. And I'll leave it at that. I don't know. I think Dr. Tetters is on if you want to say a word or two. Otherwise, we'll all just close the session.
No parting words. Just want to say thank you very much. I really appreciate you spending a little bit of time with us. And, it was just a wonderful opportunity for our faculty, staff, and students.
Thank you, Dr. Yeah. So, Mr. Bonham, Dr. Tetters is the dean of our college. So just to let you know. Okay, then. Well, thank you all for your time, and we appreciate that, and we do hope that you have an excellent week. And as always, we have recordings, and we're asking Mr. Bonham to share his slides, if you do not mind, with that, and we'll post those. We'll post the slides and the recordings. Thank you so much.
All right.
Okay.
I know.
Okay. Bye. Take care.